what are the benefits of intermittent fasting? So the known and the proven benefits of intermittent fasting are mainly on the metabolic disorders, that is body weight and diabetes, and also the lipid parameters. So almost all the studies on intermittent fasting have shown that a person who's overweight or obese, they definitely lose weight after intermittent fasting. And then those who have pre-diabetes and diabetes, their glycemic parameters, that is HbA1c, fasting blood glucose, and so those parameters also improve. So in these two things, that is on the weight and the diabetes, there are no doubts. Some studies have also shown beneficial effects on the lipid parameters, so the LDL cholesterol and triglycerides may reduce, and then few studies have shown that the effect on the systolic and the diastolic blood pressure also may reduce. But these improvements may not be significant, means in addition to fasting you may have to take help of exercise also. And then what IF has not been proven, but there are possibilities. So one is about the effects on longevity. So there have been some studies on animals and few extrapolated studies where it is perceived that if IF is practiced for long time, it could increase longevity, but there are no definitive research on this, and randomized control trials are awaited. Similarly, there are hopes that it could be beneficial in cancer, but as of now there are no good data or good study to prove that it can prevent cancer or it can cure cancer. So intermittent fasting is not a method to treat cancers. So basically, in summary, it is good for someone who's concerned about being overweight or obese or having diabetes, definitely very useful, and also for other metabolic disorders like maybe dyslipidemia and maybe hypertension also. But the most important thing is if you are having obesity or diabetes or any other metabolic disorders, always be in touch with your physician as well as a nutritionist. So it's not that you can just start and decide to do all these things, because sometimes if you are fasting and on medications for diabetes, blood sugar levels can drop. So you need to be careful also. IF is not totally without any side effects, or the possible risks also are there. The risk of dehydration, risk of electrolyte imbalance, and especially if you are on medications. So always be in touch with your physician and nutritionist before you can undertake. And the other thing is, when you start, it may not be possible to do suddenly 16 hours of fasting if you are not used to it. So you may have to start slowly and increase the fasting window gradually. Maybe you can start with 8 hours, then 10 hours, and then 12 hours. So you may take some time to go for it, and also practice it for a longer time. It's not that you do it for 8 to 12 weeks and everything is done. So whatever you do, it should be for a long term, so that you can maintain or sustain the benefits over a longer time.